University of Vermont Medical Center, and welcome to our latest health conversation on Facebook Live. Today's topic will be summer skin safety, and our guests today are physician assistant Christine Soule and Dr. Melanie Bowie. We have a quiz that Dr. Bowie is going to give at the beginning, and in the meantime, if you have specific questions, just put it in the comments below. If we don't address it, we'll address it afterwards. So before we get started, why don't you two both share a little bit about yourselves and your role here at the Medical Center.
Okay. I'm Christine Soule. I'm one of the physician assistants in dermatology. I do mostly medical dermatology. I went to school at Michigan State and UMass, and then the physician assistant program at Albany Med.
Okay. And Dr. Bowie?
I'm Melanie Bowie, and I went to undergrad at the University of Michigan, so a little rivalry here. But then I went out to Colorado and got my MD PhD at the University of Colorado, and then back to Michigan to Wayne State to do my residency, and I've been here on faculty for almost a year.
Okay, well, welcome. A full disclosure is I see Christine for skin checks, and so I wanted to start the first question to you with who should get a skin check and how often?
So not everybody needs annual skin exams. We like to have the primary care providers refer our patients. The patients who have many moles greater than 50, those are the ones who need to be checked on an annual basis. A first-degree relative with melanoma, those are the ones who are at a higher risk for melanoma, so they need to be checked. Patients who have spent a lot of time in the sun, who've had a lot of sun damage, they should at least be screened, and then we can let you know if you should be checked annually.
Okay. And there's so many sunscreens on the market. There's sprays, there's lotions, there's powders. How do you know which is the best one for you?
I'm glad you asked. I actually brought a couple kinds of sunscreen because there's so much out there that people aren't even aware of yet, because it's just such an expanding market, and they're making it more and more easy for you to be safe when you're out in the sun. A lot of people don't like the lotions because of the way they feel, and truly the best sunscreen is the one you're actually going to put on, because if it stays in the bottle, it's not doing you any good. I really like this powder that came out fairly recently, and it's SPF 50 if you can believe it, and you can just reapply over your makeup, and it's just, you know, throw it in your purse and you realize you're out and it's sunnier than you were expecting, then just go ahead and reapply. It's really convenient. And then I like this for sometimes with guys, they're not as good about putting on things on their face for sun protection, whereas women are more used to putting on foundation and applying evenly. But they have things like body washes and bar soaps and even aftershaves and gels that are just making it easier for people to actually put sunscreen on. So whatever you put on is the best.
Okay. Now, is a higher SPF better?
Yes, it is. If you're under SPF 30, you're really not getting much protection from UV radiation from the sun. You need something at least SPF 30, and I really like higher. Higher is better. About 5 years ago, they had to relabel the SPF rating systems through the FDA because they were seeing products coming out with SPF 5000 or something, which doesn't really mean anything. And so they had to go through and make sure that an SPF 100 really was higher than an SPF of another number. And the reason that I do recommend a higher SPF is because you're usually not putting enough on to get the true SPF that it says. And so if you put a 50 on and you're actually getting a 30, then you're still getting good protection.
Okay, all right, well, thanks for clarifying that. There are a lot of people out in the water, on the lake, on ponds and pools, and they're wearing water-resistant sunscreen. How often should people reapply the water-resistant sunscreen?
It's usually every couple of hours. When I'm at the beach, I actually put it on every hour, but it depends on where you are and how much you're in the water, excuse me, because it does break down. But every couple of hours, a 50
Yeah.
would be fine.
And sometimes it says on the bottle, if it's only 80 minutes, then it's something that your sunscreen will tell you
Usually, yeah.
on the packaging.
Yeah.
And the same goes true for regular sunscreen if you don't go in the water, or pretty much, yeah, just every
Good rule of
couple.
thumb.
Okay, good. So now, Dr. Bowie, there used to be a myth about getting a base tan before you went somewhere, or before
Yeah.
summer came, whether it was in the winter and you were going to the Caribbean. Could you speak to that?
Absolutely, and actually this is probably a good time to show a little photo.
Oh, right.
Yeah, because
the quiz.
this is the perfect opportunity.
Yes.
So I have a couple photos of two people, and it's just a fun thing to kind of type in the comments how old you think these two people are. So you can say, right looks 35, left looks 105. Whatever you think they look, then just type it out, because we'll give the answers of their real ages at the end, and it'll be a fun little thing to look at. But the reason I bring it up is because, you know, when you get sun exposure, even if you're tanning, the only reason you develop a tan and get that that darkening of the skin is in response to damage in your cells. So if your DNA has damage and mutations, then that's when you get the tanning. And you can't get a tan without doing that. And so if I see you with a tan, then I know that you're getting UV radiation, and that's dangerous because that's what accumulates and eventually leads to skin cancer, which is the whole reason that we're emphasizing the importance of sunscreen, because we know that sunscreen reduces the rates of skin cancer. And we don't want you here in clinic getting a skin cancer removed, because we see that a lot and it can be preventable.
Yes, because Vermont is one of the highest rates of skin cancer.
Mhm.
Yeah, so be careful out there.
Yeah.
Now, when you have, let's say you have a 15 and a 30, can you combine to make it a 45, or is it better just to keep it?
Now, patients will oftentimes, they'll have a 15 SPF in their makeup, but I tell them it doesn't count. Use a 30 or a 50, and no, you cannot combine them. Just use the 50.
Okay, yeah, I use 50. I love that powder sample.
Yeah, it's
Yeah,
50.
yeah, I'll have to get that. Now, there's mineral and chemical sunscreens. Which one's safer?
They're both perfectly safe. They're very safe products. The FDA has tested them, and they're very safe for us to put on our skin. Some people have really sensitive skin, though. It's more likely, if you're sensitive to products that you put on the skin, to be allergic to chemical sunscreens. And so that's why we recommend more of the titanium dioxide or the zinc oxide mineral blockers for kids and people with very sensitive skin, because those are a little less reactive and irritating for the skin. But you can be allergic to sunscreen the same way you can be allergic to latex or peanuts. And if you're one of those unlucky people, then you might want to steer clear of certain kinds of sunscreens. Not all of them, because there's many different kinds available, and you'll only react to a few of them, 1 or 2 or 3, and so there's other options for you.
Okay. All right, great. Now, we've often heard that being in the sun helps you get your vitamin D. So how long do you need to be in the sun to absorb the recommended amount of vitamin D, and can you still get it if you're wearing sunscreen?
You absolutely can still get vitamin D production from the skin if you're wearing sunscreen. Unfortunately, a lot of people think that they need sun for vitamin D, and it's really from the diet. You get almost all of your vitamin D from your diet. It's, vitamin D fortified milk, cereal, orange juice. That's where you're getting the bulk of your vitamin D. If you were vitamin D deficient, and were outdoors 100% of the time, you would still be vitamin D deficient, because your skin just doesn't make that much vitamin D. If it made that much, it's actually toxic to the skin, and it causes damage, and so it maxes out after like 10 minutes, and so it has to stop making that vitamin D. And if you're vitamin D deficient, don't go out in the sun to get it. You have to take a supplement. There was a study of surfers that were vitamin D deficient. I mean, you can get all the sun in the world, and it's not going to help that much for that.
Okay, well, thanks for that information. I will just do a follow-up with you. Is should you take a certain type of vitamin to help with your skincare?
For sun protection, you can actually take a HeliaCare supplement. It actually helps with the DNA damage aspect. It's not true SPF, but it helps from free radical damage. And it's plant-based, and it's just a supplement that you take like a vitamin. If you know you're going on vacation, you might want to check it out.
Okay.
And there's some people with very photosensitive skin problems that sometimes I recommend that for, and it can give a little added benefit.
Okay, good to know. And now, Christine, what medications make your skin more sensitive?
There are a lot of different antibiotics. There are some heart medications or blood pressure medications, but you just have to make sure you read the labels. And it doesn't mean that you'll just burn in the sun. Sometimes you can get a reaction, a rash from being sun exposed. So you really have to be good about protecting your skin when you're taking those medications.
Like wear, just either stay out of the sun or wear hats and long sleeves.
Long sleeves.
We didn't even talk about that, but hats
Yes.
and long sleeves are even more important than putting your sunscreen on. It's the whole package. So hats, long sleeves, sun umbrellas even, and then sunscreen.
Okay, all right.
A lot of people think that they're doing a good job by staying in the shade. But what did we find? It was the equivalent of 7 SPF.
Yeah,
by just
and
staying
a
in the
white
shade.
t-shirt is 4, so
Okay.
some things do help more than others.
Okay. We have just been given the signal that we need to wrap things up, so why don't you give the answer to the quiz?
Sure, so I know you're all, on the edge of your seat to see how old these people actually are. But the woman on the right is an American Indian who had extensive sun exposure throughout her life, and she's actually only 62. And the gentleman on the left is a 91-year-old Tibetan monk who had very little sun exposure throughout his lifetime. So another added benefit of wearing this sunscreen that we're really hoping you'll try to include into your daily routine is that it prevents photoaging, and so there's another benefit, not just skin cancer reduction, but making you look a little younger in the long term.
Vanity there, right?
Doesn't hurt.
Okay. It looks like we have a question.
There's a question. What was the vitamin that was mentioned to help with sun damage?
The name of the pill is HeliaCare, and we can type that out. It's sort of HeliOCare, HeliaCare. And if you get a sunburn, actually vitamin D taken as a supplement can help you repair that damage as well.
Okay.
Taking a vitamin D vitamin,
Okay, great.
if you were unfortunate enough to get a burn.
Okay. I've had plenty. That's why I see Christine. Well, thank you both for being here and sharing this valuable information. If any of you have additional questions, just put them in the comments below and we'll be sure to answer them afterwards. Thanks for tuning in, and we'll see you at the next health conversation. Have a great day.